Let's study what is anorectal abscess and its treatments. Majority of anorectal disease is caused by infections of the anal glands. As the infection spreads, there are spaces where the abscesses accumulate. Hence, the abscesses are named after the spaces. The most common anorectal abscess would be the perianal abscess. Abscess near the external sphincter but below the puborectalis muscle is termed as ischiorectal abscess. Meanwhile, abscess in between the internal and external sphincter is called intersphincteric abscess. At times, both the intersphincteric and ischiorectal abscess extends upward to become the supralevator abscess. Fistula is important in understanding anorectal abscesses. An anal fistula is an abnormal connection between the skin and the anal canal. Intersphincteric fistula is the abnormal connection between skin and anal canal that tracks along the intersphincteric plane and passes into the internal sphincter. Transsphincteric fistula, on the other hand, passes between the internal and external sphincter. Then, the suprasphincteric fistula goes around the external sphincter but passes the internal sphincter before going to the anus. Lastly, extrasphincteric fistula is a fistula that connects the rectum to the perineum. So generally, the treatment of abscesses is drainage. Perianal abscess is superficial, hence a simple incision and drainage will suffice. For ischiorectal abscesses, incision to drain the abscess is made through the perineum. Meanwhile, for intersphincteric abscesses, draining the abscess is done with incision in the intersphincteric plane within the anal canal. Supralevator abscess drainage is not a straightforward and requires deep understanding of the abscess, particularly its origin. So, for supralevator abscess that comes from intersphincteric abscess, drainage should be at the rectum. On the other hand, supralevator abscess that originates from the ischiorectal abscess should be drained via the perineum. What happens when supralevator abscess is drained incorrectly? Supralevator abscess from intersphincteric abscess drained via the perineum would create fistula. Remember the fistula that passes the internal sphincter but goes around the external anal sphincter? Yes, the patient will develop a suprasphincteric fistula. So this is a no-no. Also, supralevator abscess coming from the ischiorectal fossa that is incorrectly drained from the rectum will create a fistula. The extrasphincteric fistula. Again, extrasphincteric fistula that does not pass any of the anal sphincters. Here's a quick summary on how to properly drain supralevator abscess.